green pus. No one wants to see this. This is a picture, but I'm going to tell you, it can get a lot worse. This is a sign of an infection. It can actually happen after surgery, as you all know.
And we surgeons, we do not like seeing green pus. And in spite of doing everything in our power to prevent post-surgical infections, sometimes they do happen. What we have is a great new device. It's called PICO. It's a negative pressure wound vacuum device, which is very, very cool. In 1 second, I'm going to show you how it works. This little device replaces what we used to use in the past, a much larger wound vac, so you can see the difference. Okay, I want to show you how this PICO wound vac works. So take a look here. I have a wound that's obviously open, that's probably broken down. You can see that there's some pus and some drainage in there. So what I do first is just peel off the adhesive, like so. And then I create a seal around this wound that we want to drain. Make sure that's nice and tight. And patients can do this themselves at home. So this really isn't to prevent an infection. It's if you have an open wound that's draining, it's in place. I press the button to create that negative pressure. You can see it sucking down over the wound. It's going to allow quicker healing. It's going to allow quicker secondary healing, approximation of those wound edges.
You all can imagine carrying around one of those massive wound vacs if you're trying to
much more portable.
Heal from surgery.
Smaller than a cell phone.
That's so much better. And you know, in surgery, we really want to keep the wound dry, and that's what that's kind of what this process is about.
Patients can apply it pretty easily themselves. So for difficult wound problems and people that have healing issues, diabetics, underlying medical issues, this could be a good thing.